Let's be real. Nobody wants a dip in their manhood's performance. Whether you're aiming for peak fitness, stronger libido, or optimizing your fertility, testosterone is the key hormone driving it all. But here's the thing, your body needs the right fuel to make it happen. Today, we're breaking down the most important vitamins and minerals you need for maintaining good testosterone levels and improved fertility. By the end of this video, you'll know exactly what to eat, what to supplement, and what lifestyle changes can maximize your testosterone levels and sperm quality. All right, let's talk about testosterone, the king of hormones. It's what gives you energy, strength, confidence, and yes, a strong sex drive. But did you know testosterone is also directly linked to fertility? That's right, low testosterone levels can lead to lower sperm production, poor motility, and even DNA damage in sperm. On the flip side, optimal testosterone means better reproductive health, muscle mass, and mental clarity. The good news? Science has shown that you can boost your T levels naturally with the right nutrients. So, let's break them down one by one. First up, the MVP of male fertility, zinc. This mineral is absolutely essential for testosterone production and sperm health. Studies show that even mild zinc deficiency can tank your testosterone levels. Why? Because zinc is directly involved in the enzymatic reactions that create testosterone and maintain sperm motility. One study found that supplementing with zinc significantly increased testosterone in zinc-deficient men. The best natural sources? Oysters, which are basically nature's testosterone booster. Eggs and pumpkin seeds are also high in zinc levels. Aim for at least 11 milligrams of zinc per day. Here's something crazy. Vitamin D is not just a vitamin, it's actually a steroid hormone that plays a major role in testosterone production. Research shows that men with higher vitamin D levels have significantly higher testosterone. In fact, one study found that supplementing with 3,000 IU of vitamin D daily increased testosterone levels by 25%. The best source? Good old sunlight. But if you're indoors all day, get it from fatty fish, eggs, and fortified dairy, or just take a high-quality D3 supplement. Next, we have magnesium, a powerhouse mineral that enhances free testosterone levels. Free testosterone is the type your body can actually use, and magnesium helps by lowering sex hormone-binding globulin, which binds to testosterone and makes it inactive. Studies show that athletes who take magnesium have higher testosterone than those who don't. Best sources? Spinach, almonds, and dark chocolate. If you're training hard, consider supplementing with 400 milligrams daily. Now let's talk about one of the biggest testosterone killers, inflammation. Chronic inflammation can suppress testosterone and reduce sperm quality. Omega-3 fatty acids found in fatty fish like salmon, walnuts, and flax seeds help fight inflammation and improve blood flow, both critical for hormone balance. Plus, research suggests that omega-3s improves sperm shape and movement. So if you're not eating fish a few times a week, consider taking a high-quality fish oil supplement. Selenium might not get as much attention, but it's a game changer for sperm health. This mineral is a potent antioxidant that protects sperm from DNA damage. A study published in the International Journal of General Medicine found that selenium supplementation improved sperm motility and morphology. The best part? You only need 1 or 2 Brazil nuts a day to get your recommended intake. Last but not least, B vitamins. These are crucial for energy production, stress management, and hormone regulation. Vitamin B6 helps regulate androgens, while B12 is vital for sperm production and motility. Meat, eggs, dairy, and whole grains are the best natural sources. If you're vegan, definitely consider a B12 supplement. Now, here's the thing. Getting the right nutrients is only part of the equation. Your body actually needs to absorb them properly. Supplements can be useful, but they're not magic pills. Whole foods should always be your priority. Many testosterone boosters on the market are underdosed or unproven. Stick to clinically studied ingredients like ashwagandha and fenugreek. To sum it up, if you want to naturally boost your testosterone and fertility, focus on getting enough zinc, vitamin D, magnesium, omega-3s, selenium, and B vitamins. Add in good sleep, strength training, and a clean diet. If you found this video helpful, hit that like button and subscribe for more science-backed health tips. Imagine waking up multiple times at night just to urinate. Imagine feeling like your bladder is never truly empty. For millions of men worldwide, this isn't just an occasional annoyance, it's a chronic reality. If you're over 50, or if you care about men's health, this is something you need to know. Today, we're diving into the science behind an enlarged prostate, or benign prostatic hyperplasia, BPH, its symptoms, its causes, and why understanding it could make a big difference for you or someone you love. The prostate is a small gland, about the size of a walnut, located just below the bladder and surrounding the urethra. Its primary role is reproductive. It produces seminal fluid, which nourishes and transports sperm. But here's the problem. As men age, the prostate often grows in size, and because it encircles the urethra, that growth can put increasing pressure on the urinary tract, leading to a range of uncomfortable symptoms. So, what does this mean in everyday life? If you have BPH, you might experience frequent urination, especially at night, a condition known as nocturia, difficulty starting urination, a noticeable delay when trying to empty your bladder, weak urine stream, reduced flow and force, dribbling at the end of urination, incomplete emptying can cause persistent leakage, urgency, sudden strong urges to urinate that are hard to control, urinary retention. In severe cases, the bladder may be unable to empty at all, requiring emergency intervention. BPH isn't necessarily life-threatening, but it can significantly affect quality of life. And if left untreated, it can lead to complications like urinary tract infections, bladder stones, and even kidney damage. So what causes this enlargement? The exact mechanisms of BPH are still under investigation, but there are several well-established scientific explanations. One of the leading theories is that hormonal imbalances drive prostate growth. As men age, testosterone levels gradually decline. However, another hormone, dihydrotestosterone, a byproduct of testosterone, continues to accumulate in the prostate. Studies suggest that excess DHT stimulates prostate cell proliferation, leading to gradual enlargement. Interestingly, research also suggests a connection between estrogen and prostate growth. While testosterone levels fall with age, estrogen levels remain relatively stable, creating an imbalance. Some studies propose that estrogen may contribute to prostate tissue overgrowth. Genetics also play a role. Men with a family history of BPH are more likely to develop the condition. Additionally, aging itself triggers changes in growth factor signaling pathways that regulate prostate cell turnover, leading to progressive enlargement. By age 60, about 50% of men will experience some degree of BPH, and by 85, that number jumps to 90%. While BPH is not prostate cancer, its symptoms can significantly impact daily life. If you're experiencing these symptoms, a doctor can diagnose BPH through a digital rectal exam, DRE, to assess prostate size and shape, urine flow tests to measure the strength of your urine stream, prostate-specific antigen, PSA blood test. While PSA levels can be elevated in both BPH and prostate cancer, it helps in evaluating prostate health, ultrasound or cystoscopy, to examine the bladder and urethra for obstructions. Managing BPH depends on symptom severity. Some key strategies include lifestyle modifications, reducing caffeine and alcohol intake, avoiding drinking fluids before bedtime, and staying active can alleviate symptoms. Medications, alpha blockers, relax prostate muscles, while 5-alpha reductase inhibitors shrink the prostate by blocking DHT production. Minimally invasive therapies, transurethral resection of the prostate, TURP, or laser treatments, can remove excess prostate tissue. Surgery. In severe cases, prostate removal may be necessary. The good news? BPH is highly treatable. Whether through lifestyle changes, medication, or medical procedures, most men find significant relief. The key is early diagnosis and proactive management. Thank you for joining us in this deep dive into enlarged prostate and BPH. If you found this information valuable, please like, subscribe, and share to help spread awareness. And remember, staying informed is the first step toward better health. See you next time. Did you know that 1 in 4 men under 40 experience some form of erectile dysfunction? Erectile dysfunction isn't just a problem for older generations. It's increasingly affecting men of all ages, and its causes may be more complex than you think. Today, we deep dive into the science of erectile dysfunction, the causes, treatments, and surprisingly effective natural remedies that might help. If you're someone who's curious about health and wellness, stick with us as we unravel this important topic. Erectile dysfunction, also called impotence, refers to the inability to get or maintain an erection sufficient for sexual intercourse. Though it's often considered a taboo topic, ED is more common than we think. In fact, the Massachusetts Male Aging Study revealed that around 52% of men aged 40 to 70 experience some form of erectile dysfunction. But what exactly causes this condition? Is it just a normal part of aging, or could there be underlying factors that we need to address? First, let's talk about physical causes. ED often stems from issues that affect blood flow or nerve function. Here are the most common physical contributors. Cardiovascular disease. Reduced blood flow due to clogged arteries or heart disease can directly impact the ability to achieve an erection. Conditions like high blood pressure and diabetes also contribute to vascular issues. Hormonal imbalances, low testosterone levels, thyroid issues, or other hormonal irregularities can interfere with sexual function. Neurological disorders. Conditions like multiple sclerosis or Parkinson's disease can affect the nerves responsible for arousal and erection. Certain medications, including antidepressants, antihypertensives, and some over-the-counter drugs may have side effects that interfere with erectile function. Now let's move to psychological causes. ED isn't always about the body. Sometimes it's the mind that holds the key. Stress, anxiety, and depression can cause or worsen ED. The constant worry about performance can create a vicious cycle, making it even harder to achieve or maintain an erection. Relationship problems and a lack of intimacy can also be psychological triggers. Mental health plays a pivotal role, and addressing these concerns with therapy or counseling can help. Let's not forget about lifestyle factors. Smoking, excessive alcohol consumption, lack of exercise, and poor diet all contribute to ED. In fact, a study published in the American Journal of Cardiology showed that men who are physically inactive are more likely to develop ED. Now that we understand the causes, let's discuss treatment. The standard approach to ED often involves prescription medications, such as Viagra, Cialis, or Levitra. These medications help improve blood flow by inhibiting an enzyme called PDE5. While they're effective for many, they don't address the underlying causes, and they come with potential side effects. That's where alternative treatments come into play. A balanced diet rich in antioxidants, vitamins, and minerals can help improve circulation and reduce inflammation, both key for sexual health. Foods like leafy greens, beets, dark chocolate, and fatty fish, which are rich in nitrates and omega-3s, can naturally enhance blood flow and erectile function. Regular exercise is one of the best natural treatments for ED. Not only does it help improve circulation, but it also boosts testosterone levels and reduces stress. Studies show that men who exercise regularly have a significantly lower risk of developing ED. Weight management is also crucial. Obesity and abdominal fat are strongly linked to erectile dysfunction. But did you know that strengthening your pelvic floor muscles can also improve erectile function? Research has shown that Kegel exercises, which target the pubococcygeus (PC) muscles, can enhance erectile strength and control. These exercises help by improving blood flow to the penile region and strengthening the muscles responsible for maintaining an erection. As we've seen, erectile dysfunction can stem from various causes, ranging from physical conditions to psychological stress and lifestyle habits. While medications can offer temporary relief, natural treatments can address the root causes and improve long-term sexual health. If you're dealing with ED, don't hesitate to talk to a healthcare professional to explore the most effective treatment for you. And remember, adopting a healthy lifestyle with proper nutrition, regular exercise, and stress management can go a long way toward improving not just your sexual health, but your overall well-being. For more tips on health and wellness, don't forget to like, subscribe, and share. We will see you in the next video. When a man struggles with erectile dysfunction, it doesn't just affect him. It can quietly erode the trust, connection, and intimacy in a relationship. But here's the truth. ED is not a personal failure. It's a medical condition, and there are real, hopeful solutions. Today, we're breaking the silence and giving you the tools you need to move forward. Welcome back to the Mindhunters. If you're new here, don't forget to subscribe for more honest conversations about men's health. Today, we're diving deep into ED and relationship issues and what every man needs to know. Let's get started. Erectile dysfunction, or ED, is the consistent inability to achieve or maintain an erection sufficient for sexual performance. It's incredibly common. Studies estimate that about 30 million men in the US alone experience it. Common causes include physical issues like heart disease, diabetes, high blood pressure, and hormonal imbalances. Psychological factors like anxiety, depression, and stress are equally responsible. Lifestyle choices such as smoking, heavy drinking, poor diet, and lack of exercise add more to the issue. The emotional toll of ED is significant. Many men feel a sense of shame and embarrassment. Let's break some common myths. Myth: ED only affects older men. Fact: while it's more common with age, ED can affect men at any stage of life. Myth: ED means you're not attracted to your partner. Fact: ED is often more about blood flow, hormones, or psychological stress, not attraction. Let's discuss how ED impact your relationship. ED doesn't happen in a vacuum. It almost always affects the relationship dynamic. When ED occurs, many couples fall into a cycle of silence. Men may feel embarrassed and pull away. Partners may misinterpret it as rejection. This can breed frustration and tension. Emotional and physical intimacy can suffer. Without open discussion, couples often experience a growing emotional distance. Men may feel like they're less of a man, leading to a loss of confidence both in the bedroom and beyond, affecting communication, connection, and overall happiness. Here's the good news: ED is treatable, and the first step is talking about it. Start with open communication. Tell your partner what's happening. Research shows that couples who tackle ED together report higher relationship satisfaction. Explore medical options. Prescription medications like Viagra or Cialis are effective for many men. Managing underlying conditions like diabetes or heart disease can dramatically improve ED. Lifestyle changes like quitting smoking, exercising regularly, losing weight, and reducing alcohol intake have been proven to help. If anxiety, depression, or relationship stress is involved, therapy can be life-changing. Cognitive behavioral therapy in particular has strong evidence for helping men with ED-related anxiety. Sex therapy and couples therapy can also help address intimacy and communication issues. Working through ED together can actually make your relationship stronger, build trust and empathy, reaffirm that love, attraction, and connection go beyond sex. Practice patience and understanding, both for yourself and your partner. Foster healthy communication. Share feelings honestly and listen without judgment. Consider couples counseling. A trained therapist can help you both navigate emotional challenges and rebuild intimacy in ways that don't solely focus on sexual performance. ED doesn't define you, and it doesn't have to define your relationship either. Prioritize self-care and mental health. Get enough sleep and stay physically active. Create a positive, supportive environment. Celebrate small victories together and focus on building emotional closeness, which in turn often improves sexual intimacy. Finally, reframe ED. It's a health concern, just like any other. Address it with compassion, understanding, and action. And you'll be surprised at the healing that can happen, both personally and relationally. If you or someone you love is dealing with ED, remember, you are not alone, and help is available. Must watch our video covering specific treatments and therapies. Don't forget to like, subscribe, and share this video with anyone who could use a little encouragement today. Thanks for watching, and remember, real strength comes from seeking help and growing stronger together. Did you know an erection might be the best way to check if your heart is in trouble? Think about it. When you're aroused, your brain tells your blood vessels to open up and send blood to the penis. But if that blood flow is weak, the erection doesn't happen, and that's often the first clue that your arteries might be clogged. Too many people chalk it up to low testosterone or stress and miss the chance to catch heart disease early. So if you've been dealing with erectile dysfunction, it might not just be about sex. It could be your body's first warning sign of a future heart attack. Hey guys, welcome back to the Mindhunters, your go-to spot for real talk about men's health. Today we're diving into a topic that could literally save your life. We're going to break down how erectile dysfunction, or ED, can be the earliest clue that something's wrong with your heart. Why shouldn't you ignore it? And what can you do right now to fix both? So let's first understand what exactly ED is and how erection works. Erectile dysfunction is when a man can't get or maintain an erection firm enough for sex. It's incredibly common and affects about 30 million men in the US alone. But here's what most guys don't realize. ED isn't always just about stress or age. In many cases, it's one of the earliest warning signs of clogged arteries and heart disease. You know, erection actually starts in the brain, and when you're aroused, signals tell the blood vessels in the penis to relax and expand. Blood rushes in, gets trapped, and boom, erection. But that whole system depends on one thing: smooth, healthy blood flow. If your arteries are narrowed or clogged, that blood can't get through, and that's when ED starts showing up. Here's where things get really interesting. The arteries in the penis are tiny, just 1 to 2 millimeters wide. The ones in your heart are larger, about 3 to 4 millimeters. So when plaque, the stuff that causes heart disease, starts building up, it blocks the smallest arteries first. That means ED can show up years before a heart attack. In fact, studies show ED can precede a cardiac event by 3 to 5 years. That's a window of time where you can change your future if you listen to your body. The interesting part is that ED and heart disease share the same troublemakers. If you're dealing with any of these, you've got double the reason to pay attention. High blood pressure and high cholesterol, diabetes, smoking, obesity, lack of exercise, and chronic stress. These factors damage your blood vessels, disrupt your hormones, and block circulation, which messes with both your heart and your sex life. So, when is ED more than just a bedroom issue? Here's the rule of thumb. If you're under 50, otherwise healthy, and suddenly experiencing ED, don't ignore it. And if you're over 50 with other risk factors, it's even more urgent. Too many people miss the chance to catch heart disease early. Here's the good news. You're not powerless. You can improve both your ED and your heart health with the same simple lifestyle changes. Get checked. Talk to your doctor about a full cardiovascular screening. Eat smart. Load up on fruits, veggies, fiber, and healthy fats. Exercise. Just 30 minutes a day of walking or cardio makes a difference. Quit smoking. It wrecks your arteries and your erections. Cut back on alcohol. Moderation is key. Reduce stress. Chronic stress damages both your heart and libido. And sure, meds like Viagra can help, but they're just a short-term fix. If the plumbing's blocked, you've got to fix the pipes. We know ED is uncomfortable to talk about, but here's the truth. It could be the warning sign that gives you a second chance. A chance to prevent a heart attack. A chance to feel better, live better, and yes, perform better. If this video made you think twice, give it a thumbs up and share it with your family and friends. You might just help save a life. Don't wait until it's too late. Your body's sending signals. Are you listening? If you're struggling with frequent urination, weak flow, or waking up multiple times at night, you might be dealing with an enlarged prostate. It's frustrating, disruptive, and can take a toll on your daily life. But did you know that nature has powerful solutions to help shrink an enlarged prostate? Welcome back to the Mindhunters. In today's video, we'll discuss the top causes of prostate enlargement and the most effective vitamins, nutrients, and natural remedies to bring relief, all backed by science. From hidden benefits of stinging nettle root to the magical effects of pumpkin seeds and zinc on the prostate, we will discuss everything. Stay with us because what you learn today could make all the difference. First, let's discuss benign prostatic hyperplasia, or BPH. It affects millions of men worldwide, especially after the age of 50. It's not cancerous, but it can significantly impact your quality of life. The main problem? As the prostate grows, it puts pressure on the urethra, making it harder to urinate. This leads to weak flow, dribbling, and that frustrating feeling of not emptying your bladder completely. But why does this happen? Let's break it down. 1. Aging. By the time men hit their 50s, over 50% will experience some prostate enlargement. By 80, that number jumps to nearly 90%. 2. Hormonal imbalance. As men age, testosterone levels decrease, while estrogen and a powerful hormone called dihydrotestosterone or DHT increase. High DHT is directly linked to prostate overgrowth. 3. Chronic inflammation. Poor diet, stress, and exposure to toxins can lead to persistent inflammation, which may contribute to prostate enlargement. Fourth and most important, zinc deficiency. The prostate has a high concentration of zinc, and studies show that low levels are linked to prostate problems. 5. Poor diet. Diets high in processed foods, red meat, and dairy can spike inflammation and worsen prostate symptoms. Now let's get into the good news. There are powerful nutrients that can actually help shrink the prostate and relieve symptoms. Here's what you need to know. 1. Saw palmetto. This powerful herb works by blocking DHT, the hormone responsible for prostate growth. Multiple studies show that it helps reduce urinary symptoms and improve urine flow. 2. Beta-sitosterol. This plant-based compound found in nuts and seeds improves urine flow and reduces swelling. It's one of the most effective natural treatments for BPH. 3. Zinc. Essential for prostate health, zinc-rich foods like pumpkin seeds, oysters, and cashews can help keep your prostate in check. Studies have linked zinc deficiency with enlarged prostates. 4. Lycopene. Found in tomatoes, watermelon, and red fruits, lycopene is a strong antioxidant that protects prostate cells and may slow down its enlargement. 5. Vitamin D. Did you know that men with low vitamin D levels are at higher risk of prostate enlargement? Fatty fish and supplements can help restore healthy levels. And last, omega-3 fatty acids. Found in fish, flax seeds, and walnuts, omega-3s fight inflammation, a major contributor to prostate swelling. Now that we've covered the top nutrients, let's dive into natural remedies that can help you feel better, faster. Stinging nettle root. A traditional remedy used for centuries, stinging nettle reduces prostate swelling and supports urinary flow. It works even better when combined with saw palmetto, pygeum bark. This African tree extract has been shown to significantly reduce nighttime urination and improve urine flow in men with BPH. Pumpkin seeds. These tiny seeds are a powerhouse for prostate health. High in zinc and phytosterols, they help shrink the prostate and improve bladder function. A handful a day can work wonders. And last, turmeric. One of the most powerful anti-inflammatory herbs on the planet, turmeric helps reduce prostate inflammation and supports overall health. Add it to your meals or take a supplement. Along with supplements and natural remedies, lifestyle changes play a huge role in prostate health. Here are some simple but effective habits you can start today. Exercise regularly. A mix of strength training and cardio can reduce inflammation and balance hormones. Limit alcohol and caffeine. These can irritate the bladder and worsen urinary symptoms. Moderation is key. Manage stress. Stress increases inflammation and disrupts hormones. Meditation, deep breathing, and quality sleep can help keep stress in check. Taking care of your prostate doesn't have to be complicated. By adding vitamins, nutrients, and natural remedies to your routine, you can take control of your prostate health and improve your daily life. If you found this video helpful, hit that like button, subscribe for more science-backed health tips, and let me know in the comments what natural remedies have worked for you. We'd love to hear your experiences. See you in the next video.